We're going to talk about why young, healthy people should complete advanced directives. As I put into the chat box, please don't hesitate to put down questions as we move forward. I do want to share that this presentation is not meant for financial or legal planning purposes and is educational in nature. So before making any decisions, be sure to review them with your own advisors to determine best fit. There is no financial cost to complete an advance directive, but the emotional cost to loved ones when one is not completed is great. I want to share my own personal experience. About 29 years ago, 3 weeks after the birth of my daughter, I wasn't feeling well last night and ended up in the hospital. Within a very short period of time, I had 105 fever and was put into surgery. I left my husband and 3-week-old daughter in the waiting room and was told that the surgery would be about 15 to 20 minutes. 4 hours later, the doctors came out to talk to my husband and let him know that the next 24 hours would be critical because I had a severe infection and it could shut down my organs due to sepsis. I will tell you that at the time I was not in the healthcare field as I am today, and now have almost 30 years of experience in healthcare and did not have advanced directives. The medical team had not talked with me about completing an advanced directive prior to going into surgery. And of course, we all thought that it was going to be a very easy fix and that I would come out with no troubles. Of course, that's not how it happened. I was very lucky that certain decisions did not have to be made over the next few days, and that I did do well and am here today. And so it did just, again, was a great reminder for me. I went in not healthy, but I came from a very healthy moment, and things turned very quickly. And that's why we are never too young, never too healthy, because it is always too early until it's too late. This experience, of course, kind of guided what I have done in my work as both a hospice social worker and now a specialist on advanced care planning and advanced directive documents. You cannot be the child of a social worker without having hearing these kind of stories and talking about advanced directives. My daughter, who shows on the screen, actually wrote a blog that is on our site talking about that you are never too young or healthy to complete these directives. One of the other reasons that she completed hers is because she was engaged, is now married, but at the time when she was engaged, legally, her fiance would not have been the decision maker according to the state. Every state has very specific guidelines as to who gets to be in control in the moment of crisis if somebody has not had an advanced directive document completed and has not chosen their person to be their decision maker, to be the voice for decisions made. She did complete her healthcare directives, and as you can see on the screen in terms of some of the things that I highlighted from her story, is that she assumed that she knew her fiance's wishes. And while she was right about most things, it was a good opportunity for them to explore and explain specific preferences so that they knew for sure and that it could be written down concretely. And in fact, the whole experience really brought them closer together. Advanced care planning is something that is for all of us. Over the age of 18, anybody can complete an advanced directive document. What's interesting to know is some of the statistics and numbers around end of life and around advanced care planning. So approximately 80% of deaths will occur under the care of a healthcare professional in some type of healthcare setting. And when the time comes to make important life decisions, approximately 50% of people are incapable of participating in those decisions. 90% of people say that talking with their loved one about end of life care is important, yet only about 27% of people have actually done so. 60% of people say that making sure their family is not burdened by tough decisions is extremely important, but 56% have not communicated those end of life wishes. 80% of people say that if seriously ill, they would want to talk to doctors about their medical wishes. 7% have actually had those conversations with their medical professionals. I have always loved this Stephen Covey slide. It all talks about control, but it really fits in this situation. The idea of us as humans is that we like to control our situations, but there are some things that we can't control. And oftentimes in those moments, we end up putting our energy, our time, our preferences, even our money into the wrong bucket. The reality are there are things we can control, things we can influence, and things we can't control. What happens medically is things we can influence, but accidents can happen that we are completely out of our control. We can, though, control what decisions we are making, who is getting to communicate those. And that's what today's conversation is about. That's what this week of events and presentations is all about. Giving you all a sense of control, sharing this information that you yourself can then pass on to family, friends, and even clients and patients if you're in those fields. We can't have this conversation until we kind of just do an overview of advanced directives. One of the sessions coming up this week is going to be a deeper dive into each one of these advanced directives and talking through the role that they play. But an advanced directive is really a document that is drafted according to the laws of that particular state regarding wishes around your healthcare, treatment, and in general, your care, where that's going to happen, how that's going to happen, who's going to be participating. These documents are only valid when you are no longer capable of making or communicating your own decisions. Sometimes people get very concerned about completing these type of documents because they feel that in the moment they sign, they're going to be giving up that control to the person they have named. Healthcare documents are different than, let's say, a financial power of attorney, which immediately upon signing can go into effect, whether or not you are competent or have capacity or not. These documents only go into effect when you are not able to, with capacity, communicate your own preferences and decisions around medical care. In Arizona, the 4 documents that we are discussing is a living will, a healthcare power of attorney, a mental health care power of attorney, and a pre-hospital out of hospital do not resuscitate document. A post document, which is a medical portable order, is not considered a specific advanced directive, but can be incorporated into these documents depending on what your health status is. These documents, for instance, a do not resuscitate document is not going to be a document that everyone will complete, but it is one of 4 that can be completed if it is appropriate for your situation medically and for the success of that type of treatment. It is important to note that as we talk about advanced directives and advanced care planning this week, that these are documents and conversations of choice and not limitation. Oftentimes people do not want to complete these documents because they don't feel that the wishes will represent them and that there is a specific kind of decision that has to be made in these documents. These documents allow you to voice your decisions based on your personal, medical, cultural, faith perspectives. The only document on this list that has a very specific one-way meaning that you would only use if it is this decision would be the do not resuscitate document. The other documents offer options around how you can complete them to really fit with your belief systems. Choose your person. I've kind of mentioned this earlier, but this is something that we are really focused on at the Arizona Healthcare Directives Registry program here at Contexture, which is if you only do one thing in your advanced care planning process this year, choose your healthcare power of attorney. Choose the person that will be your voice for decisions that you have documented, or be your voice for the representation of the philosophy of what you would want if you haven't discussed a particular situation that your medical care now finds you in. So choose your person. This allows you to have these conversations with individuals outside of the discussion around end of life. That often can end conversations for individuals for a lot of different reasons. But choosing your person, whether you are talking about an end of life situation or an accident that has put somebody into a situation where they cannot communicate for a period of time, it's important to have someone to be your voice. I think this is a really key thing to remember, is that we're not creating a directive because you are about to die. But we're wanting to live knowing that our wishes will be honored and that we have empowered the people to choose to do what we want. And that's what all adults over the age of 18 should do. This knows no generational line. This is across all generations. Oftentimes we believe that these documents are for a certain age. And so we often will go to somebody and say, Mom, Grandma, you are of a certain age. This is a document you should do. I am a big believer that we should never ask somebody to do something that we ourselves haven't completed. Because one, it shows that maybe the document's not that important. And two, it makes it seem that this is a document of your frailty, your ill health, your inability to control your own destiny. And that's not the message we want to show. We need to lead by example, whether we're a family member or whether we're a provider of care or services, to let others know this document is important enough to me that I want to share the information with you to see if you also want to participate in completing one. Some of the best conversations that I've seen families have is when they will say, Mom, Dad, I'm starting to complete this document for myself. Do you want to participate and learn a little bit more alongside me? And we can do this together. That's a great way to begin this conversation. And if you are a healthcare provider, to be able to say back, if somebody asks the question, do you have one of these? Yes, I do, because it is that valuable and important that I have completed my directive. Making decisions during stressful times is no better than playing a game of rock, paper, scissors. And in fact, it can really lead to decisions that we never meant to have and want, because often in that time of crisis, we are so undone by the emotional pieces that are happening, or by fear that is driving, or by concern that we are not honoring what somebody wants because we can't remember in that moment of crisis, that we make decisions that really are not reflective of what that person would have wanted had they been able to communicate with us. Years ago, and this story has stayed with me because of the power of it, but years ago, a colleague of mine in the health industry had a fiance who had a massive heart attack. He was young, he was in his 40s. They had not completed a healthcare directive. I will share that healthcare providers, lawyers, have no higher completion rate of advanced directive documents than the average consumer. He did not have this document. They were not legally married. It was her fiance. The family in this situation, luckily, shared that they wanted her to be his decision maker because they knew that relationship. That does not often happen because in that moment of crisis, families want as much control as they have because they can't control anything else. And there are many families where somebody else who was the listed named individual in the state to make decisions, if it's not in a directive, would have stepped up to make that. But they gave her that decision making. Unfortunately, the decision had to be made around organ donation. They had not had that conversation, but his 15-year-old son came to her and said, recently when I went to get my driver's permit, Dad wouldn't let me get it unless I checked the organ donor box. I know that he would want to have his organs donated. What a powerful and wonderful gift to be able to share with the family, to know that this is something that he would have wanted, but what an incredible burden for this young man to have been that voice versus it having been written down, versus these conversations having had happened prior to this tragedy. Distance doesn't separate people, silence does. Not having these conversations does not bring about the ability to have conversations to explore more about what someone is feeling. As my daughter shared during the time that she and her fiance spoke about their healthcare wishes, while they knew really what each one probably wanted, it allowed them to really talk through what they meant by some of the words that they had chosen to represent those very wishes. It's so important to have those conversations and really expand upon what a word can represent. Don't wait until you are ready to take action. Instead, take action to be ready. As I shared earlier, it is always too early to think about this until it's too late. Because at the moment we now recognize that we need these documents, we need to have these conversations. Oftentimes, we are not in a physical or mental state to be able to have them. Oftentimes, people will ask if these are documents you complete and then can put away and not have to think about. No, this is happens over a lifetime. These documents are fluid documents. They can change as your situation changes. So these are the 5 Ds to remember. Every decade at least, minimally, you should be reflecting on your documents to see if they continue to reflect your wishes. Divorce or change in family status. That is another time to really think, is the person I have named to be my person, is that person still my person, or should I name somebody else? Oftentimes, a new diagnosis will get us to think about things in a different way. Now there may be certain treatment options available to us that we need to determine if that's the course that we would want with our diagnosis. For instance, when I worked with patients who had Lou Gehrig's or ALS, one of the things that can often happen is the inability to both swallow, requiring a feeding tube, and breathing becomes compromised, and whether someone would want to be on a ventilator. Knowing a specific disease course will often give us information about what we want to do next in terms of treatment options. Death. Death changes things for us in several ways. One, the person that has died may have been our chosen person, and we may need to put somebody new in our healthcare agent directive as our person. But death also informs us often of what somebody has experienced and what we ourselves would want similarly in that course of death, or maybe very different. Maybe seeing hospice used as a service is something that you want to ensure is offered if it's available to you at that time based on the type of disease you have. And decline in our status, whether it's from age or illness, often gets us thinking about different options that we would want or not want in our treatment. We have lots of different resources on our website at AzHDR.org. There are forms that you can use to complete your advanced directives. There are questions you can ask of yourself or others. There's videos that help process this information. There are gamification of these very conversations that you can have with family and friends. Things like the Go Wish game, the Death Over Dinner product as well. And finding your community and finding language that may really fit with your faith, with your culture, that really represents and honors your journey around all of these kind of advanced health conversations. This, again, can all be found at AzHDR, along with all of the events that we are doing, as well as our partners are doing, not only during National Healthcare Decisions Day and month, but every month we have different events happening across the state that we will list for you to participate in. Presentations can be found on the site on the event page. For additional questions, you have different ways to reach out to us. One of the things that AzHDR is focused on, of course, is once these documents are completed, is how to register them with the Arizona Healthcare Directives Registry so that they're available when and where they are needed. We will be having a seminar specific to how to register your documents and more about the AzHDR. But there are different pathways for questions, whether it's general questions, registration of your documents, or if you are a healthcare provider, questions that need to be answered for your organization. With that, I am going to stop and open it up for any questions that may have come into the chat. Please feel free to continue to add in questions as well. Emily, do we have any questions?
Hi, Carla. Currently, we do not, but we'll leave it open for a few minutes if anyone's, thinking about something or wants to add it. But I just really appreciate the information that you provided in the presentation. So if you don't mind, we'll just kind of wait just a few moments if someone's typing, just to give them time to finish their thoughts.
Absolutely. While we're waiting, I will use some previous questions that we often get asked at these presentations. Is there a cost for advanced care planning directives? There is not. You can complete these documents with no fees associated with them, as well as register them with the AzHDR with no fee. But lawyers often will assist in these advanced directive documents, particularly if you're doing an estate plan. And it's always a good idea if there are some complex family dynamics within your family that you may want to incorporate an attorney into completion of these documents to kind of just make sure that there's no, loopholes left undetermined. I think I see maybe something in the chat.
Yes, it looks like Cayenne shared, thank you for the information and sharing your own personal story. That helps a lot.
Absolutely.
And then Dolce made a similar comment. Thank you for the information and resources. And just as a reminder, we are recording this session and we will go ahead and send out the slide deck for everyone who attended as well. I don't see anything else. Oh, Tracy made a comment. Thank you, Carla, and the AzHDR team.
Thank you, Tracy. So again, please don't hesitate to reach out to the team for questions. And also, again, you can find lots of resources on our website. And please do feel free to join us all week long for these different topics. I have to try to come up with new stories. All that I've experienced, 30 years in healthcare, allows me to have lots of stories of these. But when I know that people are going to be joining more than once, I hope that you will hear some new ones along the way. So join in for the rest of the sessions and hear a little bit more from my own personal experiences with advanced care planning, as well as stories from my many years talking and working with families, particularly who are experiencing advanced illness or end of life. So thank you all so much. And we will send out information for all attendees at the end of the week.
Absolutely. And this concludes today's webinar. Again, thank you for joining and have a great rest of your day.